Now, the big discussion on the show today is about upcoming vaccines, and that's the ZyCoV-D vaccine. Prime Minister Narendra Modi, while addressing United Nations during his US trip recently, said that India has developed the world's first DNA vaccine that can be given to everyone above 12 years of age. He also gave an open invite to manufacturers across the world to come make vaccines in India. Now, Zydus Cadila's 3-dose COVID DNA vaccine was cleared by the drug regulator DCGA last month. ZyCoV-D is the world's first plasmid DNA vaccine against COVID, and according to reports, the government expert group may recommend its inclusion in India's vaccination drive, perhaps even as early as next week. Well, to talk more about this vaccine and India's vaccine drive, we're joined by Dr. V. Ravi, Head Department of Neurovirology, NIMHANS, a member of International Advisory Board of the Sputnik vaccine, and Professor Dr. Neeta Ramesh Chandra, Specialist in Clinical Trials. Thank you so much both for joining me. And Dr. Ravi, I'd like to start with you. What can you tell us about this DNA vaccine? It's the first DNA vaccine anywhere in the world, and it's been developed right here in India.
Thank you, Gargi, for having me on the show. As you very rightly said, this is the world's first DNA vaccine for human use. It encodes, they have incorporated the spike protein gene into a plasmid vector and developed this vaccine. It has 3 distinct advantages. 1, you do not need high biosafety levels to manufacture this vaccine. It can be manufactured in a biosafety level 1 or 2 laboratory, unlike other vaccines. Number 2, it does not require a syringe and needle because the vaccine has been designed in such a way that they use a jet injector. So there is no question of injuries, and people who are scared of needles can take the vaccine easily. And the third thing is it is stable at fridge temperature. In fact, the stability studies say that at room temperature, it is stable for a couple of weeks. So these are the 3 advantages. And the fourth, of course, from the Indian context is that it has been already approved for use between 12 and 18 years. So this would be the first vaccine in India for pediatric population. So definitely this is a very good moment. And the last advantage is you can make it in large quantities because recombinant DNA technology is well standardized. Over.
All right, Dr. Neeta Ramesh. So yes, lots of advantages, and as Dr. Ravi pointed out, it's going to be the first children's vaccine in India. It can be used for children above 12 years of age. And though currently we do know in our vaccine program we're going to be prioritizing children who have comorbidities at first, and perhaps the general population of children will only get this vaccine next year.
Yes, Gargi, you are right. This is the first indigenous Indian-made vaccine, DNA technology. What is DNA technology? Is that the genetic material consisting of RNA and DNA, deoxyribonucleic acid, We have seen the Moderna, Pfizer are all mRNA vaccines, highly fragile. It breaks down with a slight change of temperature. Even with agitation, it will break up. Difficult in an Indian context. Yes, we don't have any mRNA in India, but talks are going on. DNA is an indigenous technology, highly robust, where the deoxyribonucleic acid is attached to the vector and it injected into the body. You heard our speaker tell that there is no injection. It is a force jet spray into the body, and the drug enters into the body, and the DNA, which is in the vector, gets into the body and stimulates our immune system to produce antibody against the spike protein. So that's the mechanism. Highly robust system, highly indigenous in India, and that's the promising role. And just going back into clinical trials, this technology started 1 year, just to tell everybody that how long a clinical trial takes. We started in India from the Cadila in Ahmedabad, where the trial preclinical was finished. Then they did the study on 58 healthy individuals in the last year. After that, phase 2, where they saw the escalated dosing in 1,000 healthy volunteers, and it was seen it is highly immunogenic, and it gives you 66.6% protection and almost 100% protection to prevent from severe infection. And after that, it went into phase 3 trial, and as you know correctly said, on 1st of July, DCGA gave restricted approval. And in 1st of August, we got proper approval from the Drug Corps of India, both for children 12 to 18 years and even up to the age of 99, this drug can be used because the phase 3 data is out. It is getting published in a peer-reviewed journal, and we have this minimum side effects. And I told you 66.6 is the efficacy and 100% for severity of the infection. And apart from our guest speaker, all the points holds good. And only thing is that it has 3 doses. Just remember, it's not a 2 dose. We have to give 3 times, and that's how we are proud Indians. We have made the vaccine producers, and our Prime Minister has rightly placed in the right time. And I think we are about to roll in, because by end of September,
we're waiting for more information on that. There are reports that perhaps by next week it could be included, in our kitty of vaccines that are used in the vaccination drive. Dr. Ravi, just to take that point forward, you did talk about the 3 doses, as Dr. Chandra did, and that could be a disadvantage also for this vaccine, perhaps, given that 3 doses are required. Also, that given that this is a DNA vaccine, I believe it's easy to redesign it if we have more mutations emerging. If you could explain that.
Yeah, thank you, Gargi, and that's true. The 3 doses are spaced 28 days apart. So day 0, day 28 and day 56. So the schedule that way is shorter than the Covishield schedule right now. Having said that, the company has submitted the data for 2-dose efficacy as well, which I'm told looks promising. So it may be approved even for a 2-dose schedule, in which case in 1 month you can receive 2 doses. As regards the designing of the vaccine, tinkering of the vaccine for new variants, it is very easy, because manipulating DNA in the lab without the virus, knowing the sequences of the variants, you can change the vaccine very quickly in a matter of 2 to 4 weeks and bring it into production. So that is the third advantage, the last advantage that this vaccine has. As of now, it has been tried against the existing variants, and it is protecting against all variants. That data is already available with the experts before it was cleared for emergency use. Over.
Right, and the Prime Minister, speaking about this vaccine at the UN General Assembly, he also, Dr. Anita, invited vaccine makers to come to India, and that was very interesting, and hopefully more and more will come to India. And this pandemic has really shown how India is a place, is the vaccine capital in a sense of the world, because we do make so many vaccines and medicines here in India.
Yes, Gargi, a quick one more point. Yes, eBiologicals is one of the company which has been approved to make the vaccine, and in large quantity, so that we meet the needs. And one more question you asked regarding the pediatric patients. So high priority, in definition high priority, rightly you have said, my cancer patients, renal transplant, immunocompromised, suffering from severe disease, all are upfront. Secondly, the next vulnerable is those children who are going to school, 9, 10, 11, 12. Sitting for board exams. Schools are open in several states. They all need to be vaccinated. And after that, we go on to the next set of children. So this is the priority as on today, to vaccinate them at the earliest, so that we are able to get a herd immunity along with that of the adults. So that it is an important milestone as far as India is concerned, and then we are marching forward. And your first note as you started the meeting today was that the cases, if you see, is only 29,000 and the death is 179. It is much less than what we saw last year. Yes, the curve is coming down, but yes, we have not come out of the pandemic. Again, to the viewers, don't let your guards down. COVID appropriate protocol holds good even for children, even with the DNA vaccine. Don't remove your masks, maintain distance, and because we have to live with the virus.
All right. Well, thank you so much, Dr. Anita Ramesh and Dr. Ravi, for joining me on the program on this topic.
Thank you.
Thank you. Now, the other issue we're discussing is the third wave. Now, amidst the ongoing pandemic, the Council of Scientific and Industrial Research has said that even if the third wave comes to the country, its intensity will be low. They said this last week. Earlier, Manindra Agarwal, a professor at IIT Kanpur, had said that the emergence of another wave depends on the emergence of a more infectious strain, and that perhaps in 6 months it will become an endemic disease. Currently, India's numbers have been relatively low. Active cases cases account for less than 1% of the overall cases, and the positivity rate currently is at 2.24%. Well, to talk more about India's trajectory, we're joined by Professor Bhramar Mukherjee, health data scientist, University of Michigan, and someone who's been tracking the numbers very closely. And Professor Bhramar, you had even spoken about the second wave and warned about it at the time. Now the numbers where they stand currently and the trajectory, what do they indicate?
Yeah, so things are right now looking quite good in India, as we can see that the effective reproduction number has been hovering around 1 for a long period of time. And most of India's cases are coming from a few states, right? So, for example, out of this 30,000 cases, nearly 20,000 is being counted in Kerala. And so you have to take that in perspective. And when we are looking at models, we are looking at India and India without Kerala, and we see a consistent decline in that trajectory, which is reassuring. And also, I think that Kerala has a very good testing system, and Kerala also had a low level of seroprevalence in our last sero survey. So I think that the healthcare system are managing things well. The fatality rates are low. So I think that there are some good news here, and vaccination is accelerating. So that's another part of the good news. So I think that the trajectory with 30 to 40,000 cases, 300 to 400 deaths has been sort of a constant for a long period of time. And in our models, we do see that in the next 2 to 4 weeks, we do not see a huge blip. But of course, we have to remember that the festivals are coming. It really all depends on all of us. Even and we'll talk about the United States, but even with a high degree of vaccination, we are seeing that outbreaks can happen when we are fully re-engaged in society. So not all of us can have breakthrough infections at the same time. So we have to be very cautious, but I think there is reason to be optimistic. But having said that, I think it's important to track the pandemic closely. For the last few days, for example, I'm seeing most of India's cases are coming from the southern states right now, Kerala, Tamil Nadu, Karnataka. But then we also see Mizoram, which is a small state, but consistently producing high number of cases. We also see some upticks in Goa, Jammu and Kashmir, Himachal Pradesh. So probably vacations are starting, and these are destination for a lot of tourist mobility. So we have to be really careful, because in terms of vaccination, there is still a lot of heterogeneity in Indian states.
All right. So, Professor, the main worry right now when we talk about another spike in cases is the emergence of a new variant, because, as you said, currently numbers look like they're staying manageable.
I think that there are two sides to that story. I think a lot has changed from the second wave to the now where we are now with the introduction of vaccines, right? In April or May, less than 5% of India was fully vaccinated. So there is still, and the last sero surveys showed that 21% seroprevalence in January. So still there is a huge pocket of susceptible population prior to the second wave. That situation has changed now, because the last sero survey in June and July showed 68%, right? Nearly 68% of India had antibody. And now with vaccination, we see about 27% of adults are vaccinated, and about 70% have fully vaccination, and about 70% of adults have at least received one shot. So it has changed the landscape dramatically. And so I do think that even without the Delta variant, we could have a massive spike in India when we opened up in the second, during the second wave, and we had this sense of complacency, and also the variant really added fuel to the fire. But there was a large susceptible population then, which is not the case right now. So I think we have vaccine, we have natural immunity, so we have reason to be more hopeful. But there is always this unknown, right? If a variant which is more transmissible, more lethal, immune escape, all of these properties can happen, then we are again back to the drawing board. But so far, the good news is that, yes, we have heard about waning immunity. We have heard about low efficacy against the Delta variant. But still, in protecting, every data set shows that in protecting severe disease, these vaccines are very good. So I think that that's my hope and that optimism that the situation is not the same. We'll still have some immunity even a new variant actually emerges. So that's my hope.
Right. Professor, also some experts have even predicted that in 6 months' time, COVID could become endemic in India. Is that a fair assessment? Then there are others who have warned against, putting any sort of timeline.
Yeah, so a couple of things. One is that, how we started talking about the third wave in June. I remember, I wrote a Times of India article that there is no third wave in the horizon according to our models right now, but India should prepare for the nth wave, right? And we have not seen a third wave, though there has been a lot of data astrology out there saying that the third wave has started. And I almost want to ask which date, which hour, because it seems like some kind of not based on science prediction. So as a statistician, I think one of the downsides of being a statistician is that you try to incorporate all the uncertainties in your model. So before concluding that it is going to become an endemic, I like to really wait and watch, particularly in my experience with Michigan, right? So if we see Michigan, it's 67% people have received one shot. Still, the case counts are going up. In the United States, we see that 55% people fully vaccinated, and then we see about 64% have received at least one shot. We have been able to vaccinate 12 to 18, but still 130,000 cases happening over the last 7-day average, and 2,000 deaths. So we are, before committing anything, in July, things were looking much more positive. So we have gone through such ups and downs that I would really be cautious. I'll hope that this plateau is really going to be what all of us are projecting. But at the same time, I'm not going to give this 100% certainty that this is going to happen. The thing is that for the foreseeable future, when the virus is around, we have to learn how to live with the virus, right? Our personal prevention strategies, that's very key, because public has a role to play in public health. And then also our preparedness. We have to be on high alert regardless of what happens. So I'm more concerned about how we prepare our surveillance systems, our sequencing systems, our data systems, our healthcare systems, in order to stay prepared. And even if the good news comes, we should be preparing for worse news, right?
Well, speaking about the United States, let's talk about that now. And the numbers in the US are so high because of reluctance to get vaccinated. There's just so much hesitancy and misinformation that's playing a big role, isn't it?
Yeah, so this is very unfortunate because we really do have a tool to fight this deadly pandemic. But there is also in the United States also, I think this is true for India. If you look at the Indian states, Kerala has vaccinated approximately 70% with one dose. But if you look at UP, Bihar, Jharkhand, Meghalaya, and Nagaland, these numbers are around 30 to 35%, right? So there is a wide heterogeneity in terms of vaccination rates. So if I just look at the countrywide average, that does not tell me the true pictures, because there are these pockets of unvaccinated population. So for example, the same thing is happening in the United States. Massachusetts, Vermont, Connecticut, all of these East Coast states are having 77% with at least one dose, 70% fully vaccinated. But then you go to North Dakota, West Virginia, you go to Georgia, Oklahoma, Tennessee, that those rates drop down to 40 to 43%. And even then, these are concentrated around metros in certain population. So it has not been homogeneous. So I think that's why we are seeing this outbreak. But I also would like to remind people that we see that the deaths and hospitalizations are happening much more in the unvaccinated population. But also all of us cannot fall sick at the same time with vaccination, even with vaccination, because if you have 200 million people vaccinated vaccines are not perfect, right? Even if 5%, 10% have breakthrough infection at the same time, that's enough to overwhelm the healthcare system, even if a small fraction is actually severe. So I think we have to use our caution.
All right, Professor, thank you so much for joining us again on the program.